Hello everyone, this is Dr. Shushma Saralla, consultant homeopath and clinical nutritionist at Fidicus Homeopathy. Today we are going to discuss a topic called as endometriosis. The reason for discussion of endometriosis is the growing statistics or the number of people suffering from endometriosis and also the morbidity associated with endometriosis, that is the pain associated with it, and also the infertility issues associated with people who are suffering from endometriosis. So let's dive into the topic and know in detail. So, what is this endometriosis? Remember that the female has uterus, and the uterus inside lining is called as the endometrium. If this endometrium is found anywhere else apart from inside of the uterus, then that is called as endometriosis. So, if the endometrium is present inside the layer, then that is fine. If it is present anywhere apart from this inside of the uterus, then that is called as endometriosis. Coming to the clinical features of endometriosis. So, people who are suffering from endometriosis usually are within a range of 30 to 45 years. That means, do teenagers not suffer from endometriosis? No, it isn't like that. But the major risk factor is between the group of 30 to 45. And also women who are nulliparous. What do you mean by nulliparous? That means they have not conceived or not have pregnancy. And also people who have had children, two children long time ago. For example, you have been married at a very early age, you have conceived or had two children before your 30s, and then there is a long gap. That means you have a higher risk of having endometriosis. And also, not only that, a family history. For example, either your mother or your primary sibling, like your sister, is suffering from endometriosis. There is a higher chance that even you will be suffering from endometriosis. And not only that, remember that not all endometrial patients have these symptoms. 25% of the people suffering from endometriosis do not have any sort of symptoms, but the rest 75% suffer from symptoms. And symptoms are not related with the extension of the lesion. Remember, endometriosis, even if it is extensive, the symptoms may be very little, but it depends on the site of where it is implanted. It depends on where it has been implanted and the symptoms related to it. Then let us know about the signs and symptoms of endometriosis. So what is the primary sign of endometriosis? Remember, endometriosis, there is only one major feature that you have to remember, which is P for pain. Pain in everything. Pain while you are having menses, that is severe dysmenorrhea. Okay, and also pain while urinating, dysuria. You can also have a little bit of blood in the urine, which is called as hematuria. So, dysmenorrhea, dysuria, and hematuria. And not only that, even if you're not suffering or even if you're not having or menstruating right now, you can have chronic pelvic pain, pain near the lower abdomen, which is constant, dull, and aching. That is called as chronic pelvic pain. And also, you can have pain during the intercourse, which is called as dyspareunia. And also abnormal menstruation, that means you can have heavy menstruation or you can have very little or you can have spotting in between also. And then the major issue or major concern, especially in nulliparous women, is infertility or not being able to conceive because of endometriosis. And what are the signs? Tenderness. Tenderness means pain while palpating. Okay, and also nodularity. Nodularity is when you palpate the patient, you will find small cysts or nodules. So these are the basic signs and symptoms of endometriosis. So let's go into detail of the other signs and symptoms you will be having in endometriosis. Apart from pain, pain during menstruation, chronic pelvic pain, pain during urination, pain during intercourse. Not only that, if you are right now suffering from endometriosis, then you will have other associated symptoms like you will have pain, little bit of slight pain while you are defecating, and it can also be like you can have pain while defecating, and also there can be change in the bowel movements, like you can have diarrhea or you can have constipation. And not only that, remember, endometriosis is always associated with headaches, nausea, and even vomiting. And also not only that, it is associated with fatigue. Because of the hormonal disruption happening in endometriosis, there will be sudden drop of energy or hypoglycemia in your body, leading to fatigue or chronic weakness. As you can see, diarrhea and constipation, chronic fatigue, nausea and vomiting, headaches, low grade fever because of inflammation in your body, and also hypoglycemia or sudden drop of energy because of the hormonal changes in your body. What are the investigations that you need to do if you're suffering from endometriosis? The primary investigation that everyone knows is ultrasonography. So remember, ultrasonography can detect your endometriosis but will not give you a detailed explanation of it. MRI can give you a deeper insight into the endometriosis. And not only that, remember, laparoscopy is called as the golden standard for endometriosis, where a small instrument with a camera is put into your abdomen through a small hole, where the doctor will view how extensive your endometriosis is or how far it has gone, and they can do little surgical procedures as well through laparoscopy. Remember, endometriosis means it can be detected through USG but not too much. So MRI will give you a deeper insight of the deep endometriosis, but laparoscopy is like the golden standard for endometriosis. So what do you do before doing all of this is to go to a doctor and consult, where they will be treating you or asking you their medical history and their physical examination. So what do you have in the medical history is that they will be asking you the pattern of your menstruation, any pain associated before or after or during the menstruation, any associated symptoms with the menstruation, and not only that, they will be doing a physical examination where they can find tenderness and nodularity. And not only that, there are blood tests like CA125. So CA125 is slightly raised in endometriosis, but it is not the golden standard, or it is not specific for endometriosis. And other tests like colonoscopy and cystoscopy can be suggested depending upon the extent of the endometriosis. Now, coming into the structure and function of the uterus. Every female reproductive system has this uterus. And if you can see this brown color thing, which is dark, that is the inside part of the uterus. Okay. The inside part of the uterus is lined with the endometrium. It can be differentiated into two types, which is functional endometrium and the basement membrane of the endometrium. So this functional endometrium, what it does is, whenever it is very prone to the hormonal changes. So during the 28-day cycle, it is increased. The endometrial thickness is increased and the body will expect a baby. When you're not conceived or where there is no fertilization happening, the outer layer or the functional endometrium, what it does is it is shedded out, and that process is called as menstruation or menses. So remember this basic part. So whenever I tell you the pathological part of endometrium, you will understand it in a much deeper aspect. Now let's get into the risk factors of the endometrium. Genetic cause. As I've already told you, if your mother or your primary sibling like your sister is suffering from endometriosis, that means they have some sort of a genetic code which is making them prone to endometriosis. If your mother or your primary sibling is suffering from endometriosis, then you have a higher chance of getting endometriosis. Then coming to the menstrual and reproductive factors. So what are the menstrual factors or the reproductive factors that make you prone or make you a risk factor for endometriosis? The primary thing is attaining your menarche before 11 years. That means, what is menarche? Menarche is the first appearance of your menses. That means if you're getting your first appearance of your menses before 11 years, you have a higher chance of having endometriosis. And not only that, having periods for a long period of time. Like for example, if your cycle is 28 days, that means if you're having short period of cycle, that means if your cycle or normal cycle is 28 to 35 days, if you're having menses that is very shortly, for example, your cycle of your menstruation is just 20 days or it's just 15 days, that means you're having your menstruation or your menses every 15 days or every 20 days, then you have a higher chance of having endometriosis. And not only that, prolonged bleeding during menstruation can also be a risk factor. For example, prolonged bleeding for more than 7 days can also be a risk factor for endometriosis. And not only that, if you have conceived your children before 30 years of age, that is two children before 30 years of age, then you have a higher chance of having endometriosis because of the longer gap. And also, if you're nulliparous or if you haven't conceived before 30 years, that means you have a higher chance of having endometriosis. Then coming to the reproductive factors, if you're nulliparous and you're aged above 30, or if you have conceived before 30 years and there is a long gap after the two children, then that means you have a higher chance of having endometriosis in your 35 to your 45 age. Hormonal and estrogen exposure. Remember, the estrogen in your body is the reason that the endometrium grows in size, and the progesterone maintains the endometrial growth. Remember that excess estrogen will cause increased endometrial thickness. Then that can also be a risk factor for endometriosis. And lifestyle and environmental factors. Exposure to certain chemicals and also having an unhealthy lifestyle will lead you to have hormonal disruption, excess estrogen, that can also lead to the endometriosis. Remember that people who are suffering from PCOS, they have higher amount of E1, which can also cause the increase in endometrial tissue leading to endometriosis. So PCOS can also progress into endometriosis. And immune system dysfunction. People who are suffering from immune system dysfunction can have endometriosis. How and what, we will be explaining it in the pathology part. Now coming to the causes of endometriosis. Primary or the most accepted cause is retrograde menstruation. What is retrograde menstruation? For example, this is your uterus and the menstruation comes down like it is being affected by the gravity. But remember, if there is a reflex up, like your GERD, where you are having reflex of your stomach contents into your throat, in the same manner, if you have a reflex during the menstruation, then this endometrial tissue can be lodged anywhere near your pelvic organs, leading into endometriosis. Then cellular metaplasia, that means a certain kind of a cell, for example, cell A is converted into cell B, then that is called as cellular metaplasia. If any cell in your pelvic tissue is converted into the endometrial tissue, then that is called as cellular metaplasia or a type of cellular metaplasia. Embryonic cell transformation. The cells which are responsible for the formation of your whole reproductive system, these cells can also transfer into endometrial tissue, then that is called as embryonic cell transformation. Immune system dysfunction, which we will be discussing in the pathological part, which is dysfunction or abnormal reaction to a certain allergen or a certain antigen, then that is called as immune system dysfunction. Surgical scarring. Here what we see is that people after having a C-section or people after having hysterectomy, sometimes during that C-section or sometimes during the hysterectomy operation, these endometrial cells can be lodged away from the uterus, leading into endometriosis. This is called as surgical scarring. Lymphatic or blood vessel spread. Sometimes the blood vessels or the reflex of this endometrium or certain causes may cause the endometrial tissue to be lodged in your blood vessel, and this blood vessel can carry that endometrial tissue or the cells anywhere in your body, then that is called as lymphatic or blood vessel spread. The causes of endometriosis. First is your retrograde spread, where the reflex is happening, and then is your genetic predisposition. Either if your mother or your primary sibling is suffering, then you are prone to suffer. Immune system dysfunction. For example, if there is an allergen A, then there should be a reaction called as A. But because of that altered immune dysfunction, there is a reaction called as C. That is immune dysfunction, where it is causing more damage to your body. And then hormonal factors, as we already discussed, excess of estrogen can cause increase in endometrial tissue, leading into endometriosis. Surgical scarring or transplant. For example, if you are already getting a hysterectomy done or you're having a C-section done, then during that surgery, there can be chance that your endometrial tissue can be lodged somewhere else or near your peritoneum, leading into endometriosis. Environmental factors. What are environmental factors? Certain chemicals that we are exposed to, chlorofluorohydrocarbons, and all of that stuff can cause hormonal disruption, leading into endometriosis. Lymphatic or blood vessel spread. Remember, through any of the either causes, if the tissue or the cells of endometrium are into your blood vessels or are into your lymphatic system, because the lymphatics flow throughout your body and because the blood vessels are throughout your body, it can be lodged or placed anywhere else away from your pelvic organs also. Autoimmune factors. If you're already suffering from an autoimmune disease, then you have a higher chance of having endometriosis. Menstrual onset in adolescence. That means if you're having your menarche, that is your primary appearance of your menses, before 11 years of age, then that can also be a chance or a risk factor or a cause for endometriosis. And inflammatory factors. If you are taking a lot of unhealthy food or if you're having hormonal disruption, you are having a stressful life, then that can lead into spikes of estrogen. That will lead into your slow grade inflammation, and also the foods that you consume may cause inflammation, leading into chronic inflammation which can lead into endometriosis in certain section of people. Next is your pathology or the body changes which are happening in the endometriosis. See, ectopic implantation of the endometrial-like tissue, hormonal influence, inflammation, immune dysfunction, angiogenesis, nerve growth, pain, possible lymphatic or hematogenous spread. So what are all this? Let me just explain it to you in detail. As you can see here, this is a representation of the uterus. Okay. So what happens in this endometriosis, or what is the pathology here is, for example, your endometrium is thick, it has grown properly, and there is no fertilization, then this endometrial tissue should come out through a process called as menstruation. And that basal layer of that endometrium will be still there, only the functional layer will be going out. But what happens in this endometriosis is that this reflects, for example, the menstruation should come down like through gravity, it should follow the gravity lines, but there is a reflex which is called as retrograde menstruation. This retrograde menstruation can cause the endometrial tissue to be either lodged in your fallopian tubes or near your ovary. Okay, so what happens, or anywhere else through either system, I'll explain it to you. So whenever this endometrium is lodged anywhere else, what will happen if, for example, your father or mother should be attending a function and you're not, it is not a children function or only adults should be attending and you're there, it is like you're the odd one out. In the same manner, whenever this endometrium is in the fallopian tubes or in the ovary, what will the body feel? Usually what the body will feel is that this is a foreigner and we have to destroy it. So the immune cells will come, detect the endometrial tissue and they will destroy. But what is happening in this endometriosis is that because of the unhealthy lifestyle and because of excess estrogen, that is, this more estrogen will cause the thickness to be increased, and increased thickness in rare cases can cause retrograde menstruation, and this can be lodged somewhere else. And because of your unhealthy lifestyle, that immune system which is supposed to act and destroy the endometrial layer is not acting, or it is not giving proper response. It is creating antibodies which will further cause inflammation in your body. So whenever the endometrial tissue is placed somewhere else, body should come and destroy it. Body is not coming and destroying. Not only that, this somewhere else lodged endometrium, what will happen is it will release something called as inflammatory mediators. This inflammatory mediators will cause inflammation, and this inflammation, the white blood cells should come and take care of it, but the immune system is not proper, so no taking care of it, much more destruction because of improper immune system. So what is happening? It will grow. Remember, endometrial layer, I'm telling you that it has or it is under the influence of hormonal system or the hormones. So what happens whenever it is lodged somewhere else? Whenever there is high estrogen, it will grow here also. So growing here, and it will also start to bleed. So that blood has no path to go out of your body. If it is growing inside, then through the uterus and through the vagina, it will come out. But what happens if it is outside? There is nowhere where the blood is going. So what will happen? This will cause something called as adhesions. That means if it is near your ovaries and this is your peritoneum, the blood is there, there is inflammation, what it will cause is, what the body will think is, I have to limit this. So the body will form something called as fibrous bands around that issue. So that will cause adhesion, or it is something like sticker or something like plaster. It will plaster up that area. So wherever that endometrial tissue is, in all those places there will be adhesions or plastering. So this is called as adhesion formation. And not only that, this endometrial tissue has a separate system, which is, it has angiogenesis system, where there is endometrial tissue attract or cause blood cells formation, or it will help in blood cell formation, which is called as angiogenesis. Small blood capillaries will be forming, and this blood capillaries sometimes can be disrupted, and from that disrupted blood capillary, if this is a blood capillary, sometimes because it's newly formed and not properly formed, this endometrial tissue can get inside, and this endometrial tissue will travel throughout your body, and it can be lodged anywhere. It can be lodged near your lungs, it can be lodged in your intestines, it can be lodged anywhere in the body. Okay, that is the other part, or the lymphatic spread or the blood spread of your endometriosis. I think you have understood the pathological part, where there is retrograde menstruation, where the endometrium is lodged somewhere else, immune system is not working properly, and also because of formation of blood vessels or angiogenesis. It is getting into your blood vessels and lodging somewhere else, leading into distant site endometriosis. And not only that, because it's bleeding, it will cause adhesions and also fibroid formation. Now let's note the types of endometriosis: ovarian, superficial peritoneal, deep infiltrating, and extraperitoneal. So what is superficial peritoneal endometriosis? Remember that if there is endometriosis near your peritoneal area, especially in the pelvic region, it is called as superficial peritoneal endometriosis, where the endometrial tissue is lodged near your pelvic region of your peritoneum. So what is this peritoneum? See, the body is enclosed, or the abdominal cavity is enclosed in a sheet called as peritoneum. So whenever the endometrial tissue is lodged near the peritoneum, near the pelvic area, then that is called as superficial peritoneal endometriosis, which is very common type of endometriosis. Then coming to your ovarian endometriosis. So what is this ovarian endometriosis? Whenever the endometrial tissue, this is the uterus, this is the fallopian tube, and this is the ovary. So whenever the endometrial tissue is traveling either to your fallopian tubes, this area, or to your ovaries, this area, then that is called as ovarian endometriosis. See, remember, in superficial peritoneal endometriosis or an ovarian endometriosis, in any kind of tissue, when the endometrial starts bleeding because of the hormonal balance or normal hormones that are running through your body, then that will cause bleeding because the blood cannot go anywhere else. It is lodged, or it is packed in a scar tissue called as fibrosis. If you can see here, these white bands are called as adhesions. So whenever your endometrium is bleeding, the blood cannot go anywhere else because it is not inside the uterus, and that blood pooling will cause the body to tell that you have to stop it here itself. So it will cause adhesion or scar tissue formation. So these white bands you're seeing are the adhesions. Next kind of endometriosis is a deep infiltrating endometriosis, where your endometrium is not only lodged in your fallopian tubes, in your ovaries, but also near your intestines. As you can see, the blood spotting. Wherever there is blood, then there is endometrial tissue there. So what happens if there is adhesions or fibrous bands formation? Remember, your body is going through peristalsis for your food from your mouth to your anus, where the food is metabolized. So it is going through a process called as digestion through the process or through movements called as peristalsis. Whenever there are adhesions, there is no movement at all. So there will be certain problems related with endometriosis. That is why you'll have painful defecation, or if it is lodged somewhere near your urinary bladder and there is adhesion near your urinary bladder, and that will cause dysuria or painful urination. And because of the adhesions, it can also cause dyspareunia or pain during the intercourse. Next, extraperitoneal or extraperitoneal endometriosis. Remember, as I already taught you, or I already told you in the pathology part, when there is angiogenesis in the endometrial layer, because the formed capillaries are not so strong or proper, or due to other causes, the endometrial tissue is lodged in the blood capillaries or in the lymphatic system. It can travel anywhere into your body. So this anywhere can be either your lungs or your diaphragm or anywhere else. Wherever the blood is traveling, sometimes it will deposit the endometrial layer. So it can deposit in your lung, or it can deposit in your diaphragm. It can deposit anywhere in the body. Then this is called as extraperitoneal endometriosis. Coming to the classification of endometriosis. First one, stage 1 is minimal. See, as I told you in the starting, that 25% of people suffering from endometriosis do not have like very effective or very strong kind of symptoms, or very maybe no symptoms at all. Then that is called as minimal endometriosis, where the endometrial tissue is lodged very superficially, maybe one or two sites, just that, and there is no severe pain or severe dysmenorrhea. Coming to your mild sort of endometriosis, here you will see that the sites of endometrial lodging or placement are more than the first one or stage 1, and you can see dysmenorrhea as well as starting stages of not being able to get or not being able to conceive, which is fertilization issues, can also start in your stage 2. Stage 3 is called as moderate endometriosis, where there are multiple sites of lodging of endometrium, severe pain in the menstruation, chronic pelvic pain, that is, you will have pain in your hypogastric region or in your lower abdomen regardless of your menstruation. Like even if you're menstruating, even if you're not menstruating also, you will be having sort of dull or maybe severe sort of pain in your pelvic area. That is called as chronic pelvic pain, which can be seen in a very milder form in stage 2 but prominent in your stage 3. There will be severe form of dysmenorrhea. You will have fertilization issues, and not only that, you might also experience hematuria, blood during your urination, dyspareunia, which is pain during intercourse, and also dysuria, painful urination as well. And also you might experience associated symptoms like diarrhea as well as constipation, and also not only that, you will have pain. Some people experience pain even while defecating. Stage 4 is the severe form of endometrial or endometrial lodging or placement, where it is placed everywhere or multiple sites in your body. Multiple sites are bleeding, severe form of pain, no fertility, or the person is not able to conceive at all. There is pain always in the body, and not only that, extraperitoneal lodgings or extraperitoneal placements of endometrium are also seen in stage 4. Now coming to the conventional methods of treatment. As you can see that they give NSAIDs, non-steroidal anti-inflammatory drugs for your pain management. What is the side effect of having NSAIDs? If you are taking NSAIDs on a longer run, then that can affect your kidney. And not only that, because you're taking a lot of NSAIDs, there is a problem that is occurring in your gastric area, because it will cause gastric issues or can cause acute gastritis. So you have to take pantoprazole, rabdiprazole, or rismaprazole, or other tablets which are proton pump inhibitors to reduce the effect of NSAIDs on your gastric area. And not only that, neuromodulators or taking COCs, progestins, aromatase, or GnRH. What are all these hormonal pills? Is that the problem with this is that they have mood swings, and not only that, they do not cure anything. There is temporary relief. Same with the neuromodulators as well. And then coming to the hormonal therapy, COC, progestins, or taking GnRH or aromatase, what do is that they cause a lot of mood swings. They cause in between menstrual bleeding as well. And not only that, they are not a cure for endometriosis. It is just a temporary relief that they are giving through the hormonal replacements. And then coming to the laparoscopy or hysterectomy part, if the endometriosis is vast and then there is nothing that the conventional treatment can give or to do to cure the endometriosis, what they do is through laparoscopic surgeries, they remove the cyst. But remember, removing the cyst or removing the adhesions or removing any part of endometrial tissue from somewhere isn't the main treatment. Remember that the major cause, either it can be retrograde menstruation or altered dysfunction of the immune system or anything else, any of the causes that we have mentioned in the pathological part are the reason for the endometrial tissue to be lodged somewhere else. So if you are removing what is lodged, it is okay. But what about the triggers of that endometriosis which have caused it? So remember, the conventional treatment doesn't aim at the cause or the trigger factor. It only aims at removing what has already been done. Same with the hysterectomy. For example, a nulliparous woman or a woman who has not been conceived has endometriosis. What if you are removing her uterus? That is hysterectomy. What if it is being done? That means she will never be able to conceive. And not only that, if you are removing uterus from a person who has not conceived, what are the side effects of it? Of course, she will not be able to conceive again. And also, not only that, an early hysterectomy can cause osteoporosis in women. Coming to the fertility treatments, ovulation induction or ART, this can cause a syndrome called as hyperovulation stimulation syndrome, where there is a chance of multiple pregnancies also, and also chances of ectopic pregnancies as well. Coming to the homeopathic part of treatment. So why should you choose homeopathy in the first place for your endometriosis? First thing, for any conventional treatment, it can be NSAIDs or anti-inflammatory drugs, you're taking hormonal pills, or you're taking anything for your stimulation of your ovaries, they all have a certain side effect attached to it. But in homeopathy, we do not have any sort of side effects. And also, not only that, it is holistic in nature. For example, you come to us with endometriosis. What is happening, or what is the proforma that we follow? We treat, or we first understand the trigger for your endometriosis. It can be your altered immune system, the retrograde menstruation, or anything else. So, first we will see the trigger. We will stop the trigger through a homeopathic medication, which is tailor made for you, or which is something which is only for you. It is individualistic for you. If you're going through some sort of stress, So we individualize each sort of stress and we give you medication for that. And not only that, it restores the hormonal imbalance. We do not give you any synthetic hormonal pills here. We rather give you medications which will help in balancing the hormonal problem. So if you're taking an allopathic medication or if you're taking any sort of conventional treatment, they will give you hormonal pills. What happens? They are giving you POP pills because there is progesterone resistance happening in endometriosis. So they are giving you POP pills, but here we alter or we give you medications which will help in balancing that hormonal imbalance, giving you that seamless effect. And not only that, it is deep level therapy which helps in altering the hormones, and not only that, it helps in maintaining a proper menstruation cycle. It improves the fertility rate as well as it prevents, cures, or relieves the symptoms that you're already suffering from. So, what are the precautions that you need to take if you're suffering from endometriosis? The primary thing is lifestyle modification. If you're having or living under too much of stress, or you're having very unhealthy lifestyle where your sleep pattern is not proper, but your foods that you're eating are not proper, then you need to correct that so that you don't get endometriosis. Not only endometriosis, that you don't get any sort of lifestyle disorders like diabetes mellitus, PCOS, or endometriosis. Hormonal balance. So try working out every day and also maintain the stress level or decrease the stress level, because the hormones are impacted by the amount of stress that you are going through. And also pain and stress management. Try stretching exercises which relieve the pain, and also not only that, try meditating or doing yoga which will help in your stress management. Minimize exposure to endocrine disruptors. What is this minimizing exposure to endocrine disruptors? Is that you have, like for example, you put on perfumes every day. There are certain perfumes that are in the market today which will cause a decrease or it will have an impact on the hormones in your body. So remember, so next time you're putting on a perfume, remember, go for natural or opt for natural sources of perfumes. Like you can opt for body oils which have a little bit of fragrance in them rather than putting or drenching yourself in perfume. Remember, perfumes have a lot of impact on your hormonal balance. Now coming to the consultation part of the Fidicus homeopathy. If you're suffering from endometriosis and you would like to visit us, then remember that we have two kinds of options. One is the online consultation option where you can contact us even if you're staying far away from the nearest branch of Fidicus through audio or video call consultations. And if you're staying near the nearby branches of Fidicus homeopathy, then you can come in person and contact us. Remember, you can contact us either through WhatsApp or through call through this number. If you're consulting us online, then remember, if you're having any sort of investigations which are related to the present symptom, that is endometriosis, you can share it with us and we will let you know if we need further investigation. Not only that, and don't you feel that you have to buy medication from somewhere else? Here at Fidicus, we offer you with top rated medicines which are delivered to your doorstep. If you're staying in India, then it will take about 3 to 4 business days. If you're staying in USA, 3 to 5 business days. And apart from that, it can take up to 4 to 8 business days for the medicine to reach you. You can contact us here at Fidicus through this number. You can contact us either through WhatsApp or through call. If you're suffering from endometriosis, then why should you choose Fidicus, or why would you want to associate with Fidicus homeopathy even though there are a number of homeopathic doctors near you? The reason is that here at Fidicus, it is highest chances of success as well as health. We give you top rated, best quality medications, and the patient care or the personal care that we give here at Fidicus is of top notch. And not only that, the transparency in treating the patient is also there. And also we have highest success rate. So next time if you want to choose homeopathy, try choosing Fidicus homeopathy. Thanks.
Fidicus Homeopathy.